I'll be your nurse today. What's your name?
Kylie.
Nice to meet you, Kylie. I'm just going to provide you some privacy here. And then can I get your name and date of birth? I'm just going to verify that with the computer.
Yep. Kylie Becker, August 31st, 2005.
Great. Perfect. Checks out. I'm just going to perform some hand hygiene here. Alright, and then I would get her vitals about now, but for the sake of time, we're just gonna pretend like I did them. All vitals were within limits, within normal limits. Alright, and now just a few questions for you here, Kala. Do you know what the date is today?
October 2nd.
Perfect, and do you know where you are?
St. Scholastica.
Yeah, and what brings you in here today?
Just a checkup.
Perfect, so patient seems alert and oriented to self and surroundings. She looks like she has good hygiene. All right, so now I'm just gonna start your head to toe assessment here. For starters, do we have any pain, anything that we need to worry about? So if she did have pain, I'd go through the PQRSTU and just assess that. But since she doesn't have pain, we'll just continue with this head to toe assessment. Is it okay if I touch your head?
Yep.
I'm just gonna feel for any lumps, bumps, abrasions, anything. Head feels symmetrical. All right, now I'm just gonna check kind of behind your ears, make sure that there's no breakdown. Great. I'm just gonna use a flashlight here and look in your ears. That's okay, making sure that there's no drainage, redness, anything like that. Perfect. Now I'm gonna look at your eyeballs. And then quick light coming. Perfect. And another quick light, yeah. Lovely. So eyes are reactive to light, and then if you can just follow my finger here in accommodation. Then I'm just gonna check your nose here. If you could tip your head back, I'm just gonna look. All right, looks good. No signs of deviated septum. And if you gotta open your mouth and say ah, ah. Perfect. Mouth looks moist. Teeth are intact. Uvula goes up and down. All seems normal to me. Next, I'm gonna go kind of around your neck. Is that okay if I touch it? Tell me if you have any pain. Like that. Nope. And I feel the pulses. The pulses are good. Do you have any lightheadedness, dizziness, any blurred vision? Perfect. All right, and your neck was good. Felt the pulses. I'm gonna now move on to lung sounds. So, have you had any shortness of breath recently? Any shortness of breath with activities? All right. So I'm just gonna come around to your back here. I'm gonna listen, and I'll have you take a few deep breaths in, and I'll guide you through it. All right, quick breath in. Out. In. Perfect. In. Lovely. And last one. Perfect. Lungs did not sound clunky, junky, wet, anything like that. Breath sounds good, present, and clear. Any pain with that at all? Perfect. And now I'm just going to listen to your heart here. Have you had any chest pain, heart palpitations, anything like that? Perfect. I'm just going to listen to a few spots here on your heart.
It looks like she's oriented in general. It looks like her lab, they come back for potassium will be a little lower potassium lab of 3.3, which
Perfect. Heart sounds are clear, good amplitude, and good rhythm. Any questions so far? Perfect. I'll have you can lay down and relax. All right. So I'm gonna just take a look at your arms here, making sure you don't have any cuts, bruises, bumps, anything out of the norm. Just check some pulses. Lovely. Pulses are good bilaterally. They are strong amplitude and good rhythm. Okay, I'm just gonna check your capillary refills. I'm gonna squeeze you here for a little bit. 1, 2, 3, 4, 5. Perfect. Below 2 seconds, and the other finger. 1, 2, 3, 4, 5. Lovely. All right, now I'm gonna check your muscle tone. If you could pull towards you. Lovely, and push back. Lovely. And any pain in your upper extremities lately? Anything? Perfect. Alright, I'm gonna move on down to your stomach, if that's okay. Is it okay if I pull up your shirt? Yep. Alright, I'm just gonna listen to your bowel sounds here quick in 4 different places, and then I'll just touch. Are we having any pain in our belly recently? Nope. Regular bowel movements? Yep. Perfect. When was your last one? This morning? Lovely. Bowel sounds are present in all 4 quadrants. If I wouldn't have heard them right away, I would have continued for longer, but I did hear them right away. Is it okay if I just touch your belly? You just let me know if there's any pain. Alright, belly's not distended, it's not hard, it's nice and soft. Patient was not grimacing while I was touching her belly, so all seems pretty normal to me. I'm going to ask you a little bit of a few personal questions here. When was the last time you urinated?
Half hour ago.
Okay, and you urinating frequently?
Mm-hmm.
Okay. And the color? Yellow, clear?
Yep.
Okay. Any normal smell at all? Nope. Okay. And no issues, no pain, no urinating? Alright. If she had a catheter in, I would check, make sure it's dry, intact, and clean. In the hospital, I would do a 4-eye skin check on the bottom, make sure that there's no bed sores, pressure sores, cuts, anything like that. Moving on down to the legs. Usually I would have them remove their pants or pull up their gown, but for the sake of this video, I'm not going to. I'm just going to check to make sure that there's no cuts, abrasions, anything like that. However, I am going to check for some edema in the calves. Doesn't look like there is any. Lovely. And have you had any light pain? Nope. Tracking back to your belly, I don't remember if I asked you, but have you had any pain in your belly at all? Nope. Perfect. Alright, we're going to go down to feet if that's okay. Is it okay if I take off your socks? Alright, so I'm just going to assess her pulse here on her feet in a few different places. Alright. Perfect. Pulses are present, good amplitude, good rhythm. And I'm just going to check your cap refill on your feet. 1, 2, 3, 4, 5. Alright, definitely a little slower on the feet, but they are a little chilly. Any issues that would impact that?
Nope, they are just chilly.
1, 2, 3, 4, 5. Perfect. Still a little bit slower, but that's okay. And then I'll have you pull your feet towards you. Perfect. And then push. Lovely. Alright. Well, that concludes our head to toe assessment. Do you have any questions here before the doctor comes in? Nope. Any questions for me? Anything I can get you right away? I don't think so. Perfect. So then I would record her head to toe assessment in the computer. I would perform hand hygiene, and I will make sure that her collar is within reach and that she does not have any questions. Have a good day.
Thank you.